Manila, Philippines. 6 senators on Saturday asked the Philippine Health Insurance Corporation to swiftly amend its policy on hospital tent coverage following reports that patients were paying P1,000 per hour because the state-run agency would not cover their temporary stay. We appeal to PhilHealth not to ignore the cries of families who have no recourse but to shell out their last money because PhilHealth will not cover patients queuing in the ER or those in temporary tents, Senators Nancy Binay, Joe Villanueva, Juan Miguel Sabiri, Sonny Angara, Sherwin Gatchalian and Grace Poe said partially in Filipino in a joint statement. Related stories. Hospital group seeks reinforcement as Philippines battles COVID-19 surge. Week-long ECQ may not be enough to decongest hospitals. Fabi hindi po ito maliit na bagay, huwag naman po sana maging manhate. This is no small matter, let's not be numb to it. Ad choices. Learn more about this ad. This interest-based ad was served to you by Tremor Video DSP. Visit Tremor Video DSP's privacy policy to learn how Tremor Video DSP selects ads to serve to you or to opt out of its targeted ads. Visit the Digital Advertising Alliance to learn more or to opt out of Tremor Video DSP third-party data providers. Skip failure to adapt. Senators also criticized PhilHealth for failing to adapt to extraordinary situations amid the pandemic. Considering the continued rise in COVID-related cases, PhilHealth cannot claim, as an excuse for its indifference, being drowned by bureaucracy or being choked financially, they said. As a government corporation, it is its obligation to break the barriers and provide solutions in the midst of a healthcare coverage crisis. Villanueva the previous day said it was ridiculous for patients in hospital tents to be excluded from coverage, citing Section 6 of the Universal Healthcare Act, which mandates that every Filipino should have access to emergency health services. The patients are in the tent because the emergency room is already overflowing, so it makes no sense to exclude them from coverage from the mere fact that the emergency room is already overcrowded, he said partially in Filipino on Twitter. This was echoed by senators on Saturday who said that, under the same law, all Filipinos are entitled to PhilHealth benefits and service coverages, including emergency and comprehensive outpatient services. In a pandemic environment, PhilHealth has a social and moral obligation to serve the needs of its members. It plays a major role in implementing the UHC law and its services are crucially important, they added. In these trying times, PhilHealth should be the voice of compassion and care for every patient. It is but tragic that it has been unable to respond and reach out to the already overburdened families of patients. Issues with overcharging in hospital tents were first feared by Rep. Ferdinand Gaite, Bayan Muna, during a House probe held Tuesday. The lawmaker said one of his colleagues was charged about P140,000 for an overnight stay. Health Secretary Francisco Duque III at the time said the rate of P1,000 per hour, the rate Gaite said one of his colleagues was charged, was highway robbery. PhilHealth to launch probe, review policies. In a statement posted to social media on Friday night, PhilHealth Chief Date Giaran said the agency would investigate reported overcharging in hospital tents for possible violation of pertinent laws and rules. While noting that non-accredited community isolation unit tents are not compensable under existing rules, Giaran said that PhilHealth has been reviewing existing policies to better respond to the extraordinary demands brought about by the pandemic. PhilHealth fully acknowledges the current situation where patients are temporarily placed in tests because hospitals can no longer admit them in hospital beds, he added.